welcome to On Call After Hours, where we answer the viewer questions we weren't able to get to during the broadcast portion of our show. So we're just going to dive right into it. Let's hear them. Here we go. Here's a question from, I can't see where it's from, Hotmail. Why does SIDS peak at 2 months of age? Are there any congenital abnormalities that are linked to SIDS?
Go.
Bonnie.
It has a lot to do with the brain physiology at that point, and
the fact that babies start rolling over. Yeah, so one of the questions I get is, once your baby starts rolling over, if you see them laying down, do you have to go flip them back over when they're sleeping? And the answer is no, because once they can roll over, they're usually...
They're strong enough.
They're strong enough.
So when they can roll over on their own, you don't need to worry about it. Chelsea, Chelsea, can a thyroid problem in the mom cause issues for the baby, especially if he or she is premature?
So hypothyroid, low thyroid, is the #1 cause of mental retardation in babies. And so yes, a thyroid disease always needs to be treated.
It absolutely needs to be treated.
Absolutely.
And one of the older reasons why people used to have hypothyroidism was because they didn't have enough iodine. Now we have enough iodine.
Have enough iodine. And even like what we call subclinical hypothyroidism, obstetricians are very, very quick to treat thyroid dysfunction.
That's the
which is one of the reasons why you want to get early prenatal care.
And check thyroid. Make sure that the baby's...
There's a lot of thyroid.
So that's a reason to see the doctor.
The Northern European population has a lot of thyroid dysfunction.
We've noticed that in various studies we've done. There's a lot of thyroid deficiency here.
Right.
So if you're depressed, it might not be the winter, it might be your thyroid.
Your thyroid. Check your thyroid.
It might be.
The children that were without iodine were not mentally intact. I mean, they weren't strong enough, like their brothers and sisters who had enough iodine, and that was the original word for cretinism. Britain, South Dakota, what causes baby colic? Does it have anything to do with anything that we can talk about? The causes of colic. That goes on. That's a whole show.
Well, so I can't comment on it. It is something we don't really know. It's tummy problems. There's some indication that maybe gut flora, like it might be
the microbiome
again, so that maybe probiotic can be helpful. So we don't know.
Avoidance of milk or milk things or cow's milk questions and so on and so forth. Does it relate to infant mortality?
No.
No. This is the first pregnancy make dangerous for the mother than the second and third pregnancy? So is more dangerous? Is the first pregnancy more dangerous than the second and third?
Not necessarily, but I think you're more likely to be younger, right? You're more likely to be a teenager, so that might be related.
Okay. Yeah.
Preterm, a history of preterm birth makes you much more likely to have another one.
Preterm birth, which is dangerous for the baby.
Can I just back up to the colic question?
Sure.
Sorry. The one thing that I will say about colic is, and we rolled out something called the Period of Purple Crying to parents, and that was a state-funded effort to talk to parents about a purple crying.
That means loud.
Loud, so colic.
Yeah.
And if baby is at risk for death, it has to do with what we call shaken baby syndrome. I think there's another term for it now. So the colic is associated
with the parent going, I can't take it anymore.
That goes into our infant mortality numbers. I still think that's very low risk, but
the screaming baby.
Yeah, so
I was on call.
You just need to walk away.
You need to put them in their crib, on their back, of course, and go to the bathroom, turn on the shower.
Yeah.
I've never done that.
I held a baby that a lovely, great friend, American Indian grandmother, was there with her daughter's baby, so her grandchild. And I held the baby and carried the baby into the room to examine the ears, which is what I suspected they thought that was the problem. I can't remember whether it was the ears or not. Oh my gosh, that was the loudest noise I think I've ever heard. I mean, I was so glad when she took that baby out of that emergency room. It just amazes me how irritable it made me. Just that little bit, and you've got to be a saint to be a mother. I watched that child. It did grow up. The mom didn't kill the child. There was no shaken baby syndrome, but boy, at risk.
But I mean, it can be maddening. So.
Yeah. Any comment, Bonnie?
Is there a law in the state of South Dakota, the Good Samaritan law, where you can take a baby to a hospital?
I don't think so. Like in Nebraska, no, I don't think so.
No.
Like if you just can't take it anymore, you can
drop the baby off at the emergency
Right.
room and leave. Save the baby.
and then come back later when
Oh,
things have calmed down.
yeah. That's another, yeah.
That's actually,
That would make
Something-
sense.
There
That
is a
makes
program that I just heard about. It's through the Bethany Center where they do have some support people in those kinds of instances.
Wow.
Yeah.
That's interesting. Gregory, is postpartum depression at a risk to the infant? Can it be prevented? So, postpartum depression, the mom's depressed. Does that put the infant at risk? And can that be prevented? Can you predict
There's a lot in that. Yes, you can predict.
depression in that mother?
Untreated mood disorders in pregnancy are those
Red
women
flag,
are,
red flag.
red flag. So we have in our culture what we don't, and in South Dakota in particular, many women think that if I'm just strong enough, I can get through it, or it's a character flaw. Depression is a character flaw, and
Which is
especially,
wrong.
and I mean nothing against my people, West River, South Dakota, but I mean especially out there in a cowboy town, if you're just strong enough, you'll get through it. So untreated mood disorders are a risk. You can prevent it. You treat the mood disorder with medication, with therapy, with support afterward. And in terms of risk to the baby, depressed moms tend to not eat as well. They tend to not come in for their prenatal care sometimes. So does it put the baby at risk? Yes, it does. But in particular afterward as well, if you're not able to care for your baby, then that's bad as well.
Oh, you're
it
not
affects
gonna be-
breastfeeding.
You're not going to be as good of a mama.
Is the treatment less adverse than the effect of not having treatment? Because I know that that's
It's always a
concern.
risk benefit, and the problem with data on medications, especially when you get into this concept of polypharmacy, you can take individual medications and say we think this risk is, but then you add another medication in.
Doubles the risk.
It can change the risk, but we don't know how. And so it's always, where I usually will start with my moms is, if we can get you off everything medication-wise in the first trimester, add things back in. But my mainstay is you have to go see a therapist, because emotional work is the work none of us want to do, but all of us should do. And typically, if you can get them into that support, sometimes all you need is therapy through the pregnancy, and then we can treat afterward.
One psychiatrist guest I had when he was talking about helping people deal with depression, said, but none of this works nearly as good as exercise. And that if you can't add the exercise to the pill, it won't sustain you. Here's from Huron. What causes cerebral palsy? Is it something that we can talk about? Do we know? There's a concern. There used to be a concern that it was forceps babies, or it was something that we did during that delivery, that anoxia, that caused the cerebral palsy. What's the data on that? You know the data.
Preterm birth associated with CP. Cerebral palsy.
Right.
Infection, so infection during delivery is associated with it.
Isn't it low oxygen too?
Low oxygen can be,
So it
yep.
still is that.
So it is still that. But
But babies don't have low oxygen when they're traveling down that canal.
well, they can though. I mean, if their heart rate's low,
Or
if
they
they're not
aspirate.
oxygenating.
Yeah.
Yep.
So one more reason those problems don't occur as frequently if you've had good.
Well, to your point, placental, yeah, it has to do with blood flow in the placenta and how well babies tolerate labor. So, the healthier you are in your pregnancy, the more likely you're going to have a nicer labor.
Right. The fact, there was this lawsuit stuff that all occurred, and then they were going after anybody delivering babies in cerebral palsy that would follow, and they found that it wasn't the way that doctor delivered that baby. It was all these other factors that are out of anybody's control.
I think a lot of people mix up cerebral palsy, which is a spastic kind of, movement disorder not associated with mental retardation. And then there's this, what we call hypoxic ischemic encephalopathy, which is brain damage, which is mental retardation. And then they will have some spasticity and things like that. So, but just straight CP, it tends to be preterm deliveries. And
Okay. Bonnie, any addition there?
No.
Gestational diabetes, does it impact the baby?
amen.
Yes.
Absolutely.
So gestational diabetes means diabetes that occurs in a woman when she becomes pregnant. She didn't have it before.
Both of those.
Even if you have it before.
That puts you into high risk.
High risk. So you got to think of it like, glucose is a molecule that readily passes through the placenta. And so these babies get big And if diabetes is untreated, they come out, their blood sugars
Huge.
crash, they're humongous. So these 17-pound babies that you hear about, those are gestational diabetic babies. Those babies are sick babies. And go ahead.
That's another thing that I think is interesting about South Dakota, which you probably know this, and I'm not sure if the audience knows it. When I came here, Larry Fenton was head of pediatrics, and he had trained where I came from. And he said, the thing about South Dakota, we never have SGA babies.
SGA meaning?
Small for gestational age. Like the babies in South Dakota tend to be
They're big.
quite large.
We all have big heads.
Is that the Norwegian,
I think
German?
It's Northern European. But diabetes does well in that population too. And what women, again, they think it's like, there's a movement to be more natural, but it's really, pregnancy has overcome your body's ability to keep up with your glucose, and so, and gestational diabetes puts your baby at risk for SIDS.
Okay.
Yeah.
And the last question: are immunizations important in the first year, and do immunizations decrease infant deaths?
Yes.
Definitely.
So they decrease infant deaths.
And they're important.
And they're important.
And but there's some potential side effects.
No.
What, a fever?
Little grumpiness.
Little grumpiness. I mean, there's risks with everything that you do, but when I was a med student, I saw Haemophilus influenza in a 4-month-old that did not get vaccinated, and she and her identical twin sister were on the vent for 2 weeks, and they almost died.
And
They didn't die.
pertussis is on the rise in South Dakota.
Pertussis is
Because they aren't getting the pertussis vaccinations.
pertussis.
Right.
Yep, it's doing very well in South Dakota.
I think historically in South Dakota, vaccination rates have been quite good, but those have been dropping the last
Yep,
couple
there's a
years.
pocket.
People are afraid because there's all this national baloney information. The problem is the misinformation that is out there, people have a tendency to believe. I'm a cynic of a lot of things that we do in medicine, but I am not a cynic about, and I've watched all the immunization data. The data is solid. It's good. We need to be doing it. It protects us. And so I think it's an inappropriate fear of vaccination, and we need to do what we can.
Well, and I would also add that homeopathic approaches to immunology are not studied, they are not validated. There is no reason for you to look at, several 100 years of data on immunizations and then say, well, I'm doing homeopathic practices.
That hasn't been proven.
That hasn't ever been proven.
I mean, there's theories. We all can have theories. Let's prove the theories, and then we'll follow through on it. That's what we have to do in science. We prove the theories, we show them in a double-blinded way that it works or it doesn't work, and then we move forward.
Right.
Look at the data. Well, thank you for joining us on our website. We appreciate all your questions and the opportunity to answer them. Be sure to join us next week on South Dakota Public Broadcasting at our regular time. Call in and email your questions. Until next time, stay healthy out there, people.